member for Gilmore.
Deputy Speaker, I am always pleased to have the opportunity to talk about rural and regional health, so I am happy to rise tonight to support the Health Insurance Amendment, continuing the office of the National Rural Health Commissioner Bill 2020. Health is very important to country communities like mine. Our health system can't be a cut and paste of those in the city. We can't use a cookie-cutter approach and think everything will be fine. Country areas need to have country-specific health policy, rural-specific health policy. That is why I support this bill today, because it is recognition by the government that a rural health commissioner is necessary into the future and that more changes are needed to improve rural and regional health. When the Office of the National Rural Health Commissioner was first established in 2017, Labor raised concerns that the office would cease in June 2020. Well, it took a while, 3 years in fact, but the government has now decided that we were right, and I'm glad they did. Deputy Speaker, one of the things I notice about the government is they fight and they fight and they fight Labor, and then they realise we were right and do what we suggested. It's lovely, Deputy Speaker, but I simply wish they would get there a little quicker. Because while they dither, people in country areas suffer. That is the reality. Take the new Eurobodalla Regional Hospital, for example. This is one that I hope to one day say again, they realised we were right. But it sure is taking a while. I have been standing with the community in their calls for a new Eurobodalla Hospital for years. The current Moruya and Batemans Bay hospitals are only Level 2 facilities. They are small regional hospitals. This means that 2/3 of local patients are forced to travel outside of the area to get the treatment they need, to Canberra, Shoalhaven or Sydney. This means time away from families and friends, those essential support services. It means more expense and more stress when needing to seek vital medical assistance. In an area with a growing retirement age population, we need to make sure that our hospitals have services up to the necessary standards to meet the needs of local people. My electorate of Gilmore on the New South Wales South Coast has one of the highest number of aged pensioners in Australia, so naturally good quality hospital systems are crucial. When late last year the New South Wales Labor leader and I met with local residents in Churros Head at a kitchen table discussion, they said the poor hospital services were turning older people away. They could stay for a time, but not as they got older. It is too risky. They could see how absolutely vital this new hospital is, and I thank them all for their contribution. Deputy Speaker, the New South Wales and federal governments have been dragging their heels on this critical infrastructure for years. It was only last week that the New South Wales government even confirmed that the new hospital will be in Moruya. Very welcome news, absolutely, but we have waited a long time for it. At the same time, the New South Wales government also committed an additional $50 million, which is excellent. I welcome any additional funding towards the new Eurobodalla Hospital. I have been calling on the Morrison government to do the same. But it isn't enough just to replace what we have. We need to make sure that there is real improvement for local people and local health workers. We need to ensure the hospital is a Level 4 facility. This is critical. We need to ensure there is an acute mental health inpatient facility included. We need those assurances from the government urgently. I have long been calling for the New South Wales and federal governments to include funding for mental health inpatient beds as part of this new hospital, and I want to see the government take this issue seriously. This hospital has taken too long to get off the ground. The community rightly wants to make sure we have a facility that is fit for purpose and will provide the ongoing health support we will need into the future. As Dr Michael Holland said, the Eurobodalla Health Services Clinical Services Plan was submitted to New South Wales Health in July 2019. Improvement of services needs to be provided immediately within the existing infrastructure as requested by the petition to the New South Wales Legislative Assembly and as recommended by the New South Wales Health Agency for Clinical Innovation. He went on, the commencement of work on the single new Eurobodalla Hospital needs to occur as soon as possible. Deputy Speaker, the community on the far south coast deserves no less. Dr Holland has campaigned tirelessly, along with a number of people in the community, for improved health services in the Eurobodalla, and I thank him for his ongoing dedication to this. We are still waiting for the clinical services plan, the next important step. I look forward to seeing those details. Deputy Speaker, it isn't just Eurobodalla Hospital that is in desperate need of additional investment by this government. The Shoalhaven Hospital redevelopment has also been promised for too long without enough action to get it off the ground. Yet another example of coalition governments at the state and federal levels dragging their heels on rural and regional health. Shoalhaven Hospital is a major regional hospital. In March this year, it was revealed that 43.1% of people wait longer at Shoalhaven Hospital's emergency department than the state benchmark, ranking it 7th out of the list of longest emergency wait times in New South Wales. Absolutely outrageous and not good enough. We know that complete bed block and code black at this hospital is chronic, but the Morrison government is doing nothing to support the state in addressing these issues, and the hospital's lack of acute mental health beds is exacerbating this problem. Mental health beds are hugely important in taking pressure off emergency departments. They mean that people suffering from acute mental health episodes can get the appropriate treatment they need when they need it. But in another show of rural and regional health being put last, the subacute mental health unit at the hospital was closed for 3 weeks over Christmas during the bushfires. Cost savings with people's lives at one of the toughest times of the year. Incomprehensible. At the time, I called on the Morrison government to intervene and provide funding to keep the unit open. The Morrison government has continually said it is committed to providing the best mental health care and support for all Australians, but all they did was divert responsibility for this closure to the New South Wales government. They abandoned our community. But sadly, that is the government's record on rural and regional health. Deputy Speaker, we need to make sure that all our regional hospitals have adequate services. For some time, the community in the Milton-Ulladulla area have been campaigning for a CT scanner at the hospital. According to an article in the Milton-Ulladulla Times, local paramedics have said they have become a taxi service, taking people to Nowra to access the scanner there. Why, Deputy Speaker? Why do the people of Ulladulla have to settle for fewer services, more travel, more stress and difficulty? We deserve better than this. Deputy Speaker, the government's changes to rural health policies are hurting our communities. In 2018, the government announced a number of health workforce changes under a so-called Stronger Rural Health Strategy. The strategy sounds great, improving access to health services in the bush, but the reality is much different. The strategy changed the rural classifications for restricted doctors, that is, doctors who trained overseas or in a bonded position in Australia. These doctors can only claim Medicare benefits in defined rural areas, and in 2018 the government changed this from the long-standing District of Workforce Shortage to a new Distribution Priority Area system. I want to use the example of the Shoalhaven Family Medical Centres to show the negative impact these changes have had on practices on the New South Wales South Coast. The Shoalhaven Family Medical Centres run general practices in Vincentia, Warragee, Basin View and Culburra Beach, and I have had the pleasure of meeting with the practice owners Dr Howe and Mrs Annette Pham on a number of occasions now. Under the old system, Shoalhaven Family Medical Centres were provided with replacement provision exemptions under Section 19AB of the Health Insurance Act 1973. This meant that when an overseas-trained doctor left the practice, they were able to replace them with another overseas-trained doctor. Dr Howe and Mrs Pham advised me that at the time the changes were introduced, the practice was in the process of recruiting 2 new doctors under these provisions. In a letter I received from the Minister after the changes came into effect on 1 July 2019, the Minister advised that the Department of Health would still consider applications from practices in a district of workforce shortage area that began before the changes came into place. It is certainly the Shoalhaven Family Medical Centre's view that they should meet this requirement. However, the two doctors have been denied Medicare provider numbers because the practices are not located in a distribution priority area. The practice has sought reviews of this decision by the minister. However, I am yet to receive a response from the minister on this issue. As Mrs Pham said, the department continues to cite complex legislation which changed without their knowledge and has left them worse off than they were before. We need to be encouraging doctors into country areas. We need to be making it easier for practices to recruit and keep doctors in our community. Mrs Pham has said it is just too hard to try and wade through this, and she has given up. The government's changes and cuts to rural and regional health are hurting our providers and, by extension, hurting our communities. In January, official data confirmed that out-of-pocket costs for people in my electorate to see a doctor had increased by 34%. Local people are now paying $8.27 more per visit than they were under Labor. Why are people in rural and regional areas having to pay more to see the doctor? This government has been waging a war against Medicare for years. Health costs have never been higher than under the Morrison government, and it is rural and regional Australia that is suffering. Deputy Speaker, I have spoken on a number of occasions in this place about the Shoalhaven Women's Health Centre. This centre is based in Nowra, but it has been providing mental health outreach services to the Ulladulla region thanks to funding from the federal government. But this funding is due to cease in 13 days. And the centre has been trying to obtain a further commitment of $70,000 from the government so that they continue this outreach. Deputy Speaker, as most people would know by now, the Ulladulla region was severely impacted by the recent bushfires. We know that this has had a huge impact on the mental health of local people. You throw COVID-19 on top of that, and it is not difficult to see that we need to be increasing mental health support in these areas. But, Deputy Speaker, the government has been reluctant to provide this funding, as I said, a total of $70,000. I wrote to the minister in February this year on behalf of the centre. In March, the centre was told to try the Primary Health Network. The Primary Health Network had been given funding for additional mental health services in bushfire-impacted areas, and maybe the centre could benefit from that. Fantastic news, we thought. But, Deputy Speaker, this contract had already been awarded. So, back to the minister I went again, asking him to ensure that we don't lose this vital mental health service in the Ulladulla region. I am really pleased, Deputy Speaker, that the Shoalhaven Women's Health Centre has received some additional funding from the federal government. However, the money is for financial counselling services. Very welcome indeed, Deputy Speaker, and hard fought for. But the money cannot be used for mental health services, and so the Ulladulla outreach services remain severely at risk. So again, I ask the minister to provide the Shoalhaven Women's Health Centre with the $70,000 they need to keep this vital local service going. Time is ticking, 13 days to go. It isn't much, but it makes a huge difference to local organisations and the people they service. Deputy Speaker, we need to make sure that rural and regional areas receive targeted and appropriate services for their needs. We can't use a cookie-cutter approach. What works in the city doesn't necessarily work in the country. What works in one regional area doesn't necessarily work in another. The fact of the matter is that many of the government's changes have been hurting rural and regional areas like ours on the New South Wales South Coast. Not enough focus and attention has been paid by the federal government on improving our local hospitals. We simply aren't doing enough to recruit and keep doctors in rural and regional areas, and healthcare costs continue to rise. The government needs to take urgent action on this. They need to address it now. So, Deputy Speaker, I support this bill today, and I hope to see more changes by the government that will improve outcomes for people in rural and regional areas. I commend the bill to the House.